so glad you're here today for our PT flow or physical therapy flow. What that is simply just the PT exercises that you need or want to do for your back, your knees, your shoulders, and we're putting it into a flow that's more like yoga or Pilates. That way it's easier to do, that you don't have to keep reading a sheet and then coming back. It's not as boring, and it makes it easier for you to get in the things you need to have a healthy body, to do what you love. Today we're gonna focus on the back. Okay, so we're gonna start in a standing position. We're gonna work our way down to the floor. But if you have a pain level of 3, 4 out of 10 or higher with any of these moves, please modify. The goal of this flow is to make you feel better, not worse. So if your symptoms are worsening, please go to your own physical therapist and see what may be going on, if they can modify some of these moves that you're doing in this flow, or if they can create a flow of their own for you specifically, because everybody is different. And so I want to try to make it as easy as I can for you guys, but one size doesn't fit all. So I want to make sure that you're getting the best care. So to start, I want you to make sure you're barefoot so that we can have a good grip on the floor and we can really focus on the ground up, because sometimes even if we have back pain, it may be coming from our feet. So your feet are on the floor, and if you have bunions like me, or you have some kind of feet issues, I want you to think about doing a toe twist. So you're gonna plant that big toe, or if you have bunions on your pinky toe, plant that pinky toe and then twist that foot out so you can have a good stable base. You're gonna think about grounding that big toe joint into the ground, as well as the little toe joint in your heel. From there, I want you to raise up that arch, and so you feel like you have a really solid base on your feet. Okay, that's your platform we're working with here in the standing positions. From there, you're gonna place your hands on your rib cage, just feeling how they feel side to side, kind of rotate, nothing too big, just little movements. And then from there, you're gonna take a big, deep breath in. Now with this breath in, you don't wanna come up here, okay? But you also don't wanna just breathe into that belly. I want you to try to breathe in your back, belly, and sides, feeling that rib cage expand sideways. So close your eyes, big breath in and out. As you breathe out, I want you to really think about enclosing that ribcage by tightening your core and pushing that air out of your mouth. While you brace your core and push that air out of your mouth, I want that pelvic floor to be engaged as well, so that you're not pushing and bearing down all of your pressure down, but all that pressure comes back out through your mouth. Okay, so breathe in and relax. Breathe out and contract. Good. Another. Good. Give me 3 more big breaths. In through your nose and out through your mouth. If you notice that your rib cage is flaring as you do these, make sure you tuck that rib cage down and that pelvis doesn't come out. I'm going to show this from the side. So rib cage not flared, back not rounded, but nice and stacked over one another. And give me 1 more breath. Good. From there, I want you to again return to that kind of shifting of the rib cage side to side. This may be kind of tough for you at first, especially if you feel really tight, but really making sure that rib cage can go lateral. So your pelvis is staying the same, so you're not shifting like this, but you're shifting just that rib cage to the side, come back to neutral, shifting to the other side. Noticing how your body feels. Does one side feel tighter than the other? Do you feel any tension or pain in the back, in those muscles side to side? Does this cause any pain or shooting pain down your leg? Take notes of those. And then I want you to rotate that same rib cage, pelvis again facing forward, feet grounded, tall spine, and rib cage stacked over pelvis, side to side, feeling if you have any tightness on one side or the other. Good. Then I want you to, if you had any tension to one side or the other, or in that rotation, to take a few moments to just breathe into that. So if it's lateral, shift to that side that felt tight, breathe there. If it was rotation, rotate and breathe there. Give me 1 more breath, in through your nose, out through your mouth, and then release your arms down, shake it out just a little bit. We're gonna go into a series of flexing, so bending that spine forward. Here, making sure that if you have an increase of symptoms, to stop and probably do the reverse, or just stop and take a note and tell your physical therapist so that they can help modify what is best for you. But I want you to start out by tucking that chin to your chest and then slowly rounding those shoulders. And then rounding one vertebrae at a time, keeping your hands on your legs as you round. Really trying to get lumbar flexion here, okay? So a lot of times with back pain, we try to avoid this and we go into this kind of flexion here. That just puts extra tension on all those muscles in your back, extra tension on your glutes, and right now we're just trying to relax. So relaxing everything down, using your hands as support if you need to. And we're gonna do 10 of these. So you might have already gotten around 5, so take your time. You can always slow this video down. You can pause this video, whatever you need. Listen to your body today. Good. Find grace with yourself. You don't need to hit your toes if you only go this far. That's okay. Acknowledge that. Write that down maybe. Make a mental note and keep going. Good. On your last one, go ahead and rise up. And then you're going to reach one arm high over your head. Reach as far as you can to the side and back. So I'll show you that from the side. So reach overhead. Again, taking note if you're feeling any tension or pain in that leg, if it goes all the way down. We're trying to get rid of that, not cause more pain. So you can do a few and see if that pain gets better or if it makes your original pain better. But if it's starting to make it worse, please stop. Good, we're gonna do a couple more. This time I want you to hold and breathe into that lateral side, opening up that lat and QL on that side, and switch. Breathe and switch. Good, and then reach across, getting a good spinal twist. Again, if you had that tight rib cage, this is gonna expand that even more, keeping your pelvis still. We're really thinking about rotating that spine. Now again, volume is a factor. So if you have too much volume of bending inside and just moving your back around when you haven't been doing that, if you've been really stable and guarding, you might have some increase of pain. So slowly start, maybe doing 1 or 2 of these and then progressing forward. So give me a couple more. Now I want you to take a big deep breath in. This time raising your arms up, touching the backs of your palms, not allowing your ribcage to flare or your back to flare, but keeping nice neutral spine, reaching up high. Come down and root through those feet once again. Now we're gonna work into some single leg work here. With this, you're trying to work those hips and hip stability as well as foot stability and core stability, because that all factors into what's going on in your back. So you're gonna shift your weight onto one side. I'm gonna start with the left. It might be right for you if you're mirroring me. And you're going to lift that leg. Now, goal is to get that knee up at hip height. But if you just can tap your toe and just shift onto the left, that's where you're at right now. And welcome that, accept that, and work your way up as you feel ready. We're gonna hold this here and breathe just like we did in the beginning. Breathing in through that rib cage, nice and wide. And breathe out, contract through the spine. Good, keep holding. Starting to feel that glute really working hard. Not completely locking out that stance leg knee, but keeping it a little bit bent so you feel a little bit of wobble there. You should feel that hip flexor working on this leg, that ankle stability, really challenging yourself right now. And then go ahead and tap down. Option here too is always to tap up and down as you get used to this. Now the next thing we're gonna do is staying on that left side or whatever side you started with, and we're going to hinge at the hips, okay? So I'm gonna show you this from the side. So you're reaching back with that leg with the toe pointed down towards the ground so that your hips are parallel with the ground. You're gonna go as far as you can and hold, really contracting that core just like we practiced with the breathing. At the end of the breathing, you're bracing nice and strong. And now if this is too much for you, you can always place that leg behind you. If you have trouble with balance, you can place it out wide or even hold on to a counter or a wall. And you're just going to hinge like this, really feeling that stretch in your glute here as you come up and down, placing that weight in the left leg or whatever leg you are starting with. So again, if you're Doing the full, you can come up to that single leg stance and then down into that single leg deadlift, just like this. Good. Give me a few more. Accepting when it feels really hard, when it feels like your balance is off, when you can't maintain that stability. Accept that you're working that. That means you're trying and challenging yourself, which means you're doing something, you're being productive today. If it's not challenging enough, you can always add a rolled up towel or pillow or a rolled up yoga mat or even a yoga block to make this a little bit more challenging. Now we're gonna shift onto that right side. So again, shifting that weight over and then raising that opposite leg to hip height, thinking about strong stacked core, really balancing through those tripod foot, that big toe joint, little toe joint, and heel, that arch raise, thinking about lifting from your head, nice and tall, strong core, keep breathing. You can flex that foot on the opposite side to help get that quad activation here. Breathe, strong core. Good. Remember, you can always tap if you need to, or if you're not there yet, you can hold onto a wall or even just place your toe on the other side and shifting that weight onto this side. Now when you're ready, we're gonna take it into that single leg deadlift. So we're reaching that leg behind you, keeping a stable core, not allowing your back to arch or over rounding, but keeping it nice and neutral. Toe back towards you, not opening up that hip. Pulling up forward and reaching back. Good, strong glute power as you come up. Really focusing on squeezing and stabilizing through the whole hip on that stance leg. Good, give me a few more. Again, if you want that option, you can always tap here, just like so, or hold on to a wall or some stable surface so that you can go up and down without balance as the main issue. Give me one more. Good, now you're gonna face the front. Reaching, again, this time we're gonna shift to that first leg we started with, and we're gonna reach with that opposite leg as far as we can out, tap that toe, and return. So you're reaching as far as you can, leaning over that stance leg. So we're not here and tapping back, we're here and tapping. Really feeling that quad and glute on this side, especially because we just worked it. It should start to feel fatigued after a few. You can go a little bit faster than this if you want, or even hovering that leg and not tapping fully with that right. If this is too much for you, you can start out with just little knee taps or toe taps with a little knee bend. If this hurts your knee, this is also somewhere where it's like, okay, maybe this isn't for you. Maybe you can modify by reaching backwards instead. Something to get all of that weight onto that left side as you're moving through this exercise, still grounding through that foot, still bracing the core. Good, give me 3, 2, now we're rainbow. So tap in the front, rainbow back, tap in the back, rainbow front. Tap in the front, rainbow that foot, back, tap in the back, drag that foot, rainbow it to the front, drag it back, drag it front. So you can either up and down as you do this. So when you would reach forward, you'd bend down. When you reach back, you would be up, then down, up, or you can stay down in that down position. You should really feel this glute med firing at this point. Good. 3, 2, 1. Another option for those, the next time you do this, is adding a band for that resistance, making it a little bit harder. So other side, so you're shifting onto this right side for me, or whatever that second side is for you, and reaching out and tapping. With this one, it's also key to make sure that knee is going right over that second toe so that it's not wobbling in or out, to give you the most stability possible. Again, rib cage stacked over pelvis. That gaze is out in front of you, not too high, not looking down at your feet. So you don't want neck pain after this either. Good, keep tapping. Again, you can hover that foot to make it easier or harder, and just tap a little bit closer to you to make it easier. Give me 3, 2, and now we're rainbow. Rainbow at front to back, back to front. Good. Keep it up. Good. Give me 3, 2, and last one. Good. Shake those legs out. If you need to roll your ankles a little bit, you can. It's a lot of ankle stability during those exercises as well. This next part, we're going to move to the ground. If you need a softer surface, go ahead and grab that now. If you wanted to just do the standing stuff for one morning routine and the kneeling stuff and the floor stuff for the afternoon routine, you can do that. You can also make it all one. So we're going to go right down to the ground, but if you need to pause this video and do the rest later, you totally can. Feel your body, know your body, and take it as you can. So you're gonna make your way down to the ground however it's best and easiest for you. And your hands are gonna be right underneath your shoulders and your knees right underneath your hips. From here, we're gonna practice that breath. So you don't want to let your back sit into those shoulders, but you wanna push strongly through those shoulders. You also want that tall, tight core, and thinking about a neutral pelvis instead of a hyper extended lower back and anterior pelvic tilt, or too rounded and a posterior pelvic tilt. So you're keeping that nice and neutral. Your neck is nice and neutral too, so you don't want to be looking down at your belly or looking up too high. Okay, so at first when you're doing this belly breathing, you want to think about expanding that rib cage and expanding, letting that belly kind of sink towards the mat. Letting your pelvic floor relax as well, and then you're going to contract and brace. Breathing in and relaxing, breathing out and bracing. Good, give me some more of those. When you brace, making sure you're not crunching, you're staying in that neutral spine. When you're ready, we're gonna start with our legs. You're gonna reach one leg back, trying not to rock too much to the side. If you need to bring your knees in closer together to make it a little easier, you can do that. You don't want to reach too high either, because you're not trying to arch your back. You're just trying to reach as long as you can, keeping that neutral spine, keeping that core nice and tight, just like so. Really thinking about squeezing your glutes. You should feel this in your bottom, not in your hamstring or the back of the thigh. It should be all in that glute. If you've got that down, stop there and reach your arms up one at a time. Again, not rocking side to side, but really feeling not your upper trap or this upper area in your neck, but rather more right through that mid-back area as you reach up. If you've got that down and want to try again another technique or another advancement, you're going to take your leg back and opposite arm up and come back down, switching just like so. Now if this is easy, option to hold here and just stabilize. Thinking about tight core, thinking about balance here, not opening up that hip, but keeping it nice and stacked and strong. Good, and switch. You can hold it the whole time if you want, or you can switch with me. I'm doing about 10 to 15 seconds. Good. 3, 2, 1, and relax. Okay, to take it up another notch, what you're going to do is hover those knees. Again, you can stick to the basics here, whatever you feel feels good to you. Don't push your body too far. So tight core, hover those knees. Holding here, you can always go into that bird dog just like we just did, or you can stick to just the legs or just the arms, but option is yours. Hold it nice and tight. We're gonna hold for about 15 more seconds. Just breathing here again, option arms. Trying not to rock side to side, option together. Good, we have 5, 4, 3, 2, and 1. Drop those knees, untuck your toes. You're gonna reach back as far as you can, walking those hands as far as you can out in front of you.
Feeling a stretch all through that low back and in your glutes. And you're gonna try to breathe into this low back area. If you wanna put your hand here, you can, or just leave it out. Taking a big deep breath. Aiming that breath where it feels tight. So if it feels tight more on one side or the other, think about breathing into that area. If you do feel tight on one side or the other, you're gonna walk your hands opposite that side and just breathe into that area from there. You might feel this along your armpit or that lat area too. Give me one more breath. And then walk your hands to the other side. Again, breathing in, big deep breath. And letting that go. Good. From here, we're gonna go into a glute finder. So you're gonna walk your hands back into the center and then slowly walk your hands up so that you're on your knees. Now, if this hurts your knees, you don't have to do this and you don't have to do it this way. So find a good position for you. Also, you can support yourself with a yoga mat here to set yourself up a little higher, or even a pillow, or putting a cushion underneath your knees. But goal is from here to squeeze your glutes, come up and come back down. So you're finding those glutes, okay? If you don't feel this in your glutes or you feel it somewhere else, try to modify as you can. Another way to do that is to bring those toes underneath. Now, if this hurts your toes, again, you can modify just by pressing or pulling up those toes on a surface. So trying whatever makes this comfortable for you and wherever you can get the exercise done correctly, because you can do all of these, but if you don't feel it in the right places, then we're just doing these for no reason. So really push yourself to think and be present with your body, feeling whatever your body is feeling in that moment. Good, so give me 5 more, really feeling your glutes, power through this motion. You might feel this in your quads a little bit, but goal is to feel it mainly in your glutes. Good. And then when you're done with that, you're going to place your hands on the ground and we're gonna make your way onto your bottom. Wrapping your hands around your knees and slowly coming down to the ground. Good. From here, you're going to place your hands on your rib cage, and here we are again. We're setting up with that breath. Every position we've been in, we set up with the breath because that's so key. My natural resting position is that rib cage flared and that anterior pelvic tilt, so I really have to make sure that I get into that neutral spine, not a crunched and irritated position, but just a neutral, relaxed position. From there, if you feel like you have flared rib cage, kind of like me, like where I sit like this, or it feels like a wide rib cage out to the side, this is a time where you can work on pressing that rib cage down and helping your core engage. So what you're going to do is place your hands on that rib cage onto the side, breathing in just like we did in the beginning, expanding everything. And then as you breathe out, you're gonna press and crunch. And then again, breathing in, relaxing everything, and breathing out, and pressing in and crunching. Do a few of these just to get that rib cage involved. And then if you feel like you have that down, you can continue with that, or you can move on to the next phase where you're gonna place your hands right on the inside of that hip bone. So no matter where you have to dig to find it, you're gonna find underneath everything there, you're gonna find that core. So when you find that core, what you're gonna feel is when you brace, as if someone's gonna punch you or someone's gonna land on your stomach and you're bracing like this, I want you to find that, so you're using all those muscles and you're gonna feel into your fingertips a brace or a muscle contraction. So you're gonna feel it get tense. And where that is where I want you to feel it when you breathe out, okay? So a lot of people just breathe like this and you have this doming sensation in the middle of your belly. And what I want is that to not dome, rather to spread out nice and even throughout your whole belly. And so you're gonna feel that on the sides and underneath. That's your corset muscle. So that's a muscle we want to stabilize our spine. We don't want to overuse our rectus because our rectus is that six-pack muscle in the front that just works in the front. We want our whole rib cage. So our obliques and our transverse abdominis is that those muscles that attach to our spine in the back and wrap all the way around. So we want to make sure we have good contraction of those. Now, if you find that contraction, first you're going to start marching like so, really focusing on not losing that brace. So if you find that you start to dome in the middle or you lose that brace, stop, regain it, and start again. Now, if this feels easy to you, you can bring both legs up, again, making sure you have that brace, and heel tap down. If this feels easy to you, you can always reach out that leg, tap, and come back up, again, making sure you don't dome. If that feels easy to you, you can always tap both legs, again, making sure you don't dome like this. If you see my doming in the front, but keep it nice and tight and flat, and come back. Pick your option. We're gonna go for a few more seconds, a few more reps, breathing still. You're not holding your breath during this, but you're not relaxing when you're breathing in this time. You're keeping that core nice and braced. Good. 3, 2, 1, and relax everything down. That's a really important one for that core control. Now what we're going to do is you're going to either bridge with double leg, or we're going to progress into a single leg bridge contraction. So making sure our glute is engaging and letting our lower back relax. This is really important in low back pain. So thinking about tightening that core again, bracing through everything, and then squeezing your glutes and making sure that that's not firing your adductors or your hamstrings, but it's just that glute contraction. From there, you're going to lift your hips up. Now again, you don't want to hyperextend and get as far as you can, because then we're just working our paraspinals and those muscles back here and really tensing everything in our low back. We don't want that. We want our braced core, but we're just going as high as we can to get that glute activation, not anything more. Now, if this feels easy to you, you can come up and try to shift onto one leg. Now, with that shift, you want to make sure that you still feel it mainly in your glute. If you start feeling it more in your hamstring or more in your adductor, we have to do a little bit of glute activation first. So you can go back to that hovering position, or into that quadruped position where you're lifting your glute up, or you can even go onto your belly and try to find your glute that way. Now, if you want to just practice with your feet, the farther away they are, the more hamstring you're getting. So you can bring those heels a little bit closer to try to get a little bit more glute activation. You can also attempt to put your toes up onto an elevated surface for that as well. So here we are. If you're on that right side, I want you to switch into the left. And we're going here. If you're doing double, keep going. We're still working our glutes. We want to burn those. We want to make sure they're fatigued by the end. You really want to find your muscles here. So take your time finding those, making sure you're doing this right. We're not just going through the motions. We're making sure we're in tune with what our body is doing and what our body needs. This is our last exercise before our last and final stretch. So get a nice, good burn here. 3, 2, and 1. Good. Straighten out one leg. Reach one leg high. You can grab behind your leg and go in for some nerve glides. If you're having some radiating symptoms down your leg, this is great for you. You can bend and straighten your knee as you hold behind your knee. If you can't reach behind your knee, you can always grab a towel and hold here and bend and straighten from this position. Or if your leg can't go up that high, that's a great option. But making sure that toe is flexed towards you, so you're really working that nerve. Good, and then switch. If this starts irritating your symptoms too much, this may be too much, so you can always back off. If you want to feel a little bit deeper, you can always tuck that chin up to get even more neural tension here. Good. On your final one, you're going to keep that leg straight and you're going to let it fall out to the side and reach that arm to the opposite wall. Now, if this is too much for you, you can always bend that knee or not twist as much by holding your chest and only opening up as far as you feel comfortable. If your shoulder feels okay and you want to twist fully, you can reach that arm as far as you can, holding here. Breathing into this hip, breathing into your spine. Good. If your leg was bent, go ahead and straighten it and come back up. Or if you feel more comfortable with keeping that knee bent, go ahead and come back to neutral. Straighten that leg. Switch legs. Try it straight. If it's straight is bothering you, you can always bend that knee and then open that arm to the opposite side. Breathing here. Aiming for that area on your back that feels the most tight as you breathe. Looking towards that hand. Okay, give me 3, 2, one more breath. 1. If you were somebody who felt good doing the flexions while you were standing, you can end by holding your knees here. If you felt better with the extend, or you felt worse with the flexions, you can always try extensions. So you're gonna roll into your belly and end with just 10 extensions, just like so. Here, coming down. And then when you're done with those, slowly make your way up to standing, whatever is best for you.
Give me one big deep breath. And I will see you next time. If you enjoyed this PT flow, stay tuned for more, and hopefully we'll get out some more for your knees, your shoulders, and even more for your low back so you can feel healthy, safe,